I would treat your breast augmentation or breast cancer reconstruction the same as you would with any other treatment. How you go to the doctor regularly and get a checkup, they should be checked.
The question that has been posed to us on multiple different occasions is, when is it time to remove my implants? So we'll kind of do this. We're going to go over, what the manufacturer says. We'll go over our clinical expertise. We'll see what recourse you have for those people who are about to get breast augmentation with implants. Let's see what options are available for you in the event that we eventually do change out your implants, and answer some other questions that hopefully will help clarify. Because you are the expert in breast augmentation, I'm going to let you take it from here.
It really is a great question. And if you ask 10 different plastic surgeons, they may all answer differently. If you would have asked this question to me 14 years ago, I would have answered it very differently than I do now, because my experience is significantly more. And this is what I would have said back then. If it ain't broke, don't fix it. I have completely changed my mind. Completely changed my mind. Yeah. And it's interesting because has there been the one-offs that I've taken an implant out that's been 35 years old and it comes out without any problems? Sure. But generally speaking, there is a lifespan for all of these implants. Just remember, guys, it's a medical device. It's just like
body.
It's like anything else. It's like a car that you drive or shoes that you wear or a bra that you put on or a t-shirt that you wear. Everything has a lifespan. On the safe side, I say 10 years, no problem. And that's what most manufacturers will tell you. Keeping an implant in for at least 10 years is okay. I tell people when it's between 10 and 15 years is when you really should start thinking about doing a removal and replacement. If there's absolutely nothing wrong, still, I think it's a good idea. Interesting part is the recommendations are to get some sort of screening. And I'm talking about silicone implants right now, but you can make the generalization for all implants. The big difference between silicone and saline is with saline implants, you'll remove them 100% because over 10 years, so much of that saline is going to deflate that you're going to be left rippled and a little bit deflated. So it'll be more of like a reminder, okay, change implants. Whereas silicone implants, if nothing happens to them, and it really is difficult to cause any type of defect in an implant, but if there's nothing wrong, most people are like, why do I need to get them changed? Problem is that outer shell, over time, I think, does thin a little bit. The integrity is not as good as it was 10 years before. Think about a car that you drive for 10 years. Think about a pair of shoes that you wear every day for 10 years. So the surveillance story is this, and this is what I recommend. Every 3 to 5 years, an ultrasound. Simple. Now, the manufacturer will tell you, because they have to really cover themselves, is go get an MRI, because MRI is a lot more sensitive. But most clinicians that do this a lot will tell you an ultrasound is just as good. If there's something wrong with your implant, an ultrasound will pick it up. Simple test, non-invasive, very quick. Every 3 years.
Much cheaper.
And super cheap. Yep. Every 3 to 5 years, get an ultrasound, make sure it's okay. I personally would switch them out between 10 and 15 years, especially if there's no issues. A lot of times, especially if you have submuscular implants, if they're under the muscle, you may have implants that are a little further lateral because the implant will push them laterally. At the same time, you can tighten up the lateral pocket, tighten up the inferior pocket. If you want to go smaller, you can go smaller. If you want to go bigger, you can go bigger. If you need a lift, you can get a lift. All that stuff happens around 10 to 15 years. Interestingly, implant manufacturers have a different warranty, each one. Mentor and Allergan have a 10-year warranty. Sientra has a 20-year warranty. I don't think it means that you can keep your implant in for 20 years and there be nothing wrong. However, they're giving you that warranty. So if you wanted to keep it longer, you're still covered. Now, the warranty really just covers deflation or rupture. It doesn't really cover malposition or capsular contracture or things like that. But it's in a very simple way. If you have implants, I would be cognizant to at least have your plastic. See, the way we do it here, or the way I do it is, I see you regularly your first year, and then the second to third year, I see you every 6 months, and then 3 years on, I see you once a year. A lot of surgeons don't do that. I would advise everyone, see your plastic surgeon once a year. You have a foreign body in your chest. make sure everything is okay. Make sure everything feels okay. Sometimes, even though everything feels okay, there still may be something wrong. Get your ultrasounds every 3 to 5 years. And then somewhere between 10 and 15 years, I would probably swap them out.
Let me ask you, so obviously this is for cosmetic breast surgery, but my thought is, what about for those individuals who are undergoing breast cancer reconstruction? So let's say they get implants placed. Do they still have to follow the same rules?
Yeah, I mean, all implants are pretty much the same. Mm-hmm. The big difference is with implant-based breast reconstruction, you have a much more obvious look at everything in the sense that there's no breast tissue covering anything. So if you have a ripple, you see it. If you have deflation with saline implants, it's a lot more evident. If you have a rupture, even though the new generation of cohesive gel implants, you may never tell, you may be able to see it a little bit easier. I would give the same recommendations. Anywhere between 10 and 15 years, swap them out. Just so, and this is what I've noticed, the difference in my philosophy from 15 years ago to now is this. I think that the longer you leave them in without changing them, the higher the chance of complications.
Mm-hmm. I've seen you struggle through some really bad capsular contracture. And it just becomes a much bigger surgery for the patient. I mean, you do so much of it and you're so good at it, but at the same time, it's a much bigger operation. You could potentially, the patient would have zero pain where you just inject the incision site, make a small incision, remove the old implant, put in the new, and
it's really that easy. Technically, it could be done under local, even though I wouldn't do it under local. But it's such a difference, and it's interesting because I see a lot of these surgeons on Instagram and TikTok taking out these implants and saying everyone needs an end-block capsulectomy and all this stuff. It's because they're taking out 35-year-old implants, and then they take them out, and everything's all over the place. The outer shell is completely disintegrated. It's like, I mean, you've left them in for so long, you're going to have issues. And that's one thing that I say. It's like with anything. If you go to the dentist regularly and you have checkups and you clean your teeth, the chances of having cavities or a root canal are almost none. Whereas if you leave it alone and go every 5 years, well, you're going to find things. So I would treat your breast augmentation or breast cancer reconstruction the same as you would with any other treatment. How you go to the doctor regularly and get a checkup, they should be checked. You've got a foreign body. I'll never forget my father had a pacemaker, and very similar. He'd have to go get a pacemaker check. He'd have to get batteries changed. It's the same type of thing. There's got to be a maintenance on it. And guys, if your plastic surgeon that did the procedure for you doesn't want you to go in every year, go see someone else and just make sure you're okay, and just get a baseline ultrasound, get your follow-ups, and go see someone every year just to make sure the integrity of the implant's okay, and you're good to go. Because just like Dr. Layke said, by changing the implant really early or at an appropriate time, you won't have to have capsulectomies, you won't have to have drains, you won't have to have a ruptured implant that can have issues. It's just a simple removal and replacement, what we call an oil change around here.
Yep, definitely. For those of you who are interested in a breast augmentation, you know that some of your options, the companies have warranties. If something should fail within a certain period of time, depending on the company, they will help reimburse for replacement. But the idea, it's so interesting that you started off with one philosophy, and then you completely switched because you start seeing the complications associated. So for those of you who have implants and they're approaching the 10-year mark, or you're between 10 and 15 years, I would consider removing the implant, just a quick removal replacement, and you buy up another 10 years. For those of you who had them in for much longer, at least have them evaluated, just because you run into a complication and it just becomes a much bigger surgery.
And experience is key, guys. And again, I'm not saying that I'm the most experienced plastic surgeon in the world, but the longer you do the same thing over and over again, the more you learn. And it's interesting because I used to say, leave them in. There's nothing wrong. What's the problem? But then when you see that it could be an issue, and how prevention is key, just like anything else. If you can prevent having issues by just removing your implants and putting new ones in, why not? Just keep a close eye on them. And I think then you will just, if you haven't any issues, just keep a close eye, get your ultrasounds, make sure everything is okay. And you don't have to rush and get them changed, but go see a board certified plastic surgeon so you can have the proper recommendations.